Thank you, Dr. Lee. Thank you, Dr. Brand, for joining us today. So, my first question, Dr. Lee, is for you. In light of the incident that's come up of a pregnant woman giving birth to a child at the door of Surrey Memorial Hospital, what's currently going on at Fraser Health? Is it just damage control, or is this any kind of corrective actions going on at Fraser Health?
Thank you for having us and thank you for the question. I first want to start by um, relaying my sincere apologies for the patient's experience because I was quite saddened to hear about it. And of course, for every birth that occurs, and over 15,000 births occur at Surrey Memorial Hospital, our clinical teams strive our best to ensure that everybody's having best experience as possible, especially when you're bringing new life into this world. So I'm very saddened to hear about it. We have been in touch with the family and we will review if there's been any breaches into the protocol or standards. But I also want to ensure that your listeners are aware that we have very strict standards and tests based on best evidence, and we follow those protocols. So we will ensure that a review takes place, and we take every opportunity to improve patients' experience, and we'll do the same here.
Dr. Lee, we ever since this news came out, we had multiple talk shows at our radio station, and multiple women have come forward sharing their experiences of delivering their children at Surrey Memorial Hospital, and some of the experiences have been very traumatic for them. Is Fraser Health aware of such problems existing at the birthing unit of Surrey Memorial Hospital?
Thank you for that. And I, again, was quite saddened to hear some of the other patient experiences as well. So if you have specific callers or information about the callers, we're more than happy to reach out with each of the patients and experiences. And I think there's a couple of things I wanted to mention around that. One is, of course, we strive our best to deliver great patient experience. And if we didn't meet that expectation, we will review and do what we can to learn from the opportunity and learn from that experience. And we apologize sincerely for that. I think some of the concerns that I heard are around being examined. So a woman in labor might be in active labor versus not. And when you're early in labor, you don't have to be staying in the hospital because our best practice and guidelines tell us actually you do better in your own environment at home where you have family to support you and you're less likely to get unnecessary medical intervention. So that's why there's that practice in place that women are examined if they're worried, but then they're informed that the best place is at home. And then, unfortunately, in some cases, there are unique or extraordinary circumstances where people deliver much quicker than anticipated or escalate very quickly. And I think those are some of the experiences that we heard about. So we will look at our protocols in place with that in mind as well. And Dr. Burrows is a specialist that delivers babies, and I wonder if he has anything to add in that area.
Thanks, Dr. Lee, and I think your comments were very true. Whenever a patient comes to any of our institutions in Fraser Health, every patient is assessed and the decision regarding management is made. If active labor is present or there's another concerning issue, of course the patient is admitted. If there's no sign of active labor and the patient is low risk, and the patient's often sent home. As you mentioned, that's the best place for her to be from a safety and intervention perspective.
I spoke to one woman yesterday who claims that she was sent back to her home, and while she was in her labor pains, and she ended up delivering the child at her home. Now, this incident, according to her, was back at the end of October. It's almost been 3 months since, and she claims that no investigation, even though she complained to Fraser Health about it, no investigation or no action has been taken yet. What do you say to complaints like these, or people who have experiences like these? When should they expect some kind of concrete investigation and the result of that investigation?
Thank you for sharing that experience. And I would be very appreciative, of course, with the patient's consent, if she's able to connect with us. And I will look into that matter immediately as soon as we hear from her and the complaint and the issues that were raised. And I think every individual case, when there's a formal complaint, goes through our feedback and complaint process, and if there's any, we link back with the patient and also with the clinicians and the team, and if there's any areas of improvement, we also share those with the patient. So if that's not occurred, then I'd love to have the opportunity to connect back with her.
Dr. Lee, in our conversation with our listeners, a lot of calls that we got yesterday regarding Surrey Memorial Hospital. One of the constant complaint that we heard was that some of the staff working at Surrey Memorial Hospital's birthing unit is not fair to their patients, and the treatment meted out is very rude. Um, are you aware of such complaints?
I am not aware of that specific complaint, but again, we would very much appreciate the specific individuals and concerns, and then we can review and assess the situation. And again, apologize if that was the experience from the patient. Certainly, I think sometimes there are circumstances outside of what's happening, because every healthcare provider, I know that throughout the pandemic and even now into the fifth wave, people have been working extremely hard, and they're there every single day to ensure that we're looking after the well-being and care of our patients and their families. And I think, at some point, and this is not at all to make excuses about that experience that patient has encountered, but healthcare providers are also people, and they are going through individual experience that might impact that care. But in every situation, if there is a negative encounter, or that it's felt that they were not dealt with or the situation was not dealt with in a appropriate and professional manner, we would very much appreciate following up with the patient.
Um, Dr. Lee, moving forward, people who are angry or who are upset, who had a bad experience at SMH, and who complained and did not get a resolution to their complaints, what would you say to them? What has changed in last few days that will give them hope that their complaints would be heard and corrective actions would be taken?
Thank you. And we would very much appreciate hearing from you for all of the complaints or concerns that you may have. There's the complaint process. My encouragement is, if you're encountering any kind of experience that's not meeting your expectations, to let the nurses or the manager on site on the unit know right away. If that's not working, then there is a formal complaint process that we have at Fraser Health. And if you go onto our website, complaint feedback, you can access that process right away. And we do follow up 100% through those processes that we have established formally as well. And there's escalation processes. If you're not satisfied with our response, that we can also support you through provincial escalation to ensure that your concerns have been heard. And in all of the cases that we've reviewed, we take every opportunity to see the improvements that we can make, and we will do the same with the very unfortunate experience that we've heard about around patient experience with the deliveries at SMH recently.
Right. And my last question, Dr. Lee, would be, um, in light of the incident, I guess the general public wants to know, would this change things at Fraser Health? Would this have caused some sort of action from Fraser Health to maybe shake up things a little bit and bring about some change in the way things are done at Surrey Memorial Hospital or Fraser Health in general?
I think it's important to note that right now we need to ensure that, of course, the patient experience has been reviewed thoroughly, and we've reached out to the patient to hear about her concerns directly. What we then do is review what has occurred. So I think it's premature for me to say that there's going to be specific changes made due to this patient experience. We want to make sure that we fully look at the encounter and patient experience and look at what we need to do, and if there's learnings, what kind of learnings would take place. So certainly we are following up very closely, and we'll do it in a timely manner, and we'll be sharing that with the patient as well.
Dr. Lee and Dr. Jason Burrows, thank you so much for your time and good luck for future.
And thank you so much for having us. And please do connect with us with the specific patients and their contact information so that we can follow up with them.
Absolutely, will do.
Thanks very much.
Thank you.